And welcome back. Well, we all know someone who puts up with pain. Hopefully that'll just go away on its own.
Both of us. But instead, the problem gets worse. You know what we're talking about. Our next guests are experts in treating pain in the foot, ankle, heel, and toes. Dr. Romy Patel and Dr. Okay, I got to make sure I get this right. Isidoro Zambrano.
Yes.
Is that
Got
close?
it.
They are both with Advanced Foot and Ankle of Wisconsin. In just a few minutes, we're going to tell you how they are broadening their experience as well. Great to see both of you.
Thanks for
Thanks so much.
As well, yeah, absolutely.
I find even some of our guests were like, I have foot and ankle problems. I think it's a very common problem for people to have.
Yeah, and you know, it's really common for patients to kind of have pain and then just put it by the wayside until it gets so bad that they have to undergo something more intense that they could have prevented from before.
Yeah, it's so true. We're both in that boat. I've been to your office seeing Dr. Coquette,
Yeah,
and
absolutely.
I think you guys are wonderful. What do you think makes you guys different at Advanced Foot and Ankle?
So first and foremost, I'd say our philosophy of always putting the patient first. You know, our doctors and our staff, you know, that's the most important thing for them. And then to complement that, we have 5 foot and ankle surgeons and 1 orthopedic surgeon who are trained in the latest procedures. So that way we know we're giving our patients the best care possible.
Yeah.
What are the benefits, as you see it, to minimally invasive surgery?
So minimally invasive surgery is good for patients who are always on the go, maybe patients like yourselves that can't, you know, afford time off for an extended period of time. It minimizes the complications and it's more cosmetically pleasing because the incisions are smaller.
Yeah. What would be a minimally invasive procedure? What kind of thing?
A classic one is doing a bunion. You know, a lot of
Okay.
patients get scared off. Oh, you know, non-weight bearing time.
Yeah.
My skin's going to be healing for so long. We can do that minimally invasive for them so that they can get back to work or whatever they might be doing quicker.
Okay.
I'm glad we have this up on the screen right now, because this is just an example of the many different things, the variety of things that you treat, from bunions and heel and toe problems to ankle or orthopedic surgery. You also do, as we mentioned, the minimally invasive surgery. And I always wonder, because as I'm dealing with ankle problems, I always wonder, how do I know when it's enough of a hassle or enough of a pain to see a doctor and have a consultation?
Yeah, so, you know, yourself, you're not diabetic, but patients that do have diabetes, they should be seeing, podiatrists even if they don't have pain.
Right.
And then for our general patient, I usually tell patients, you feel like you rolled your ankle or you bumped it against something, you rest it, you iced it, you elevated it, and it's still hurting you, it's time to come see us.
Yeah, don't live with the pain, right?
Yeah, absolutely.
Dr. Zambrano, what kind of orthopedic procedures do you specialize in? I guess, what are you doing most often? Are you seeing the most common issues?
Most commonly shoulder, hip, and knee problems.
Yeah.
Working with podiatrists, I don't do feet. So basically shoulder, hip, and knee.
Yep.
As it relates to hips, I'm glad you mentioned that. Our executive producer just had hip replacement surgery, but a lot of people look at the shoulder, the knee, the hip. What do you think is important for people to know in terms of hip problems and the procedures that do a replacement versus other procedures?
I'm going to go ahead and talk about a hip replacement.
Okay.
Here's a model of a hip replacement where you see that the hip cup has been replaced.
Yeah.
The head has been removed, and a stem has been placed in there.
Oh, it's a whole thing you put
Whoa.
inside the bone?
Yes.
Oh my goodness.
That's
okay.
crazy.
Now it's weird because, like you said, I'm thinking about our executive producer.
Oh,
what they did.
whoa.
Yeah. What had happened? So then, when that's done, what kind of mobility can people expect? A full mobility and a full recovery?
Full recovery, yeah, but it depends on the approach.
Yeah.
There's certain limitations with a lateral approach, which is coming in from the side, posterior approach coming in from the back, or anterior approach coming in from the front.
Okay.
And there's about 15 to 20% of surgeons in America who come in from the front. The rest of them come in from the side and back.
Which one do you do?
Yeah.
I come in from the front.
From the front.
And
okay.
why is that? Is there a reason that you prefer that to the other places to come in?
Other approaches?
Yes, other approaches. Yes. Yeah.
Yes, there's several advantages. So as far as muscles are concerned, when you come in from the side, you take down part of the hip abductor. When you come in from the back, you take down some of the short external rotators. When you come in from the front, you're basically going in between muscle bellies.
Oh, so the recovery is faster?
Yes, so you're not waiting
Gotcha.
for the muscles to heal.
Why doesn't everybody do that?
It's a very high learning curve. When you start doing these, you have to limit your practice, and it takes about 40 to 50 cases to finally become proficient.
Oh,
Because
okay.
you're working in a small hole.
Are you there yet? You're proficient?
In my opinion, yes.
That's a big deal. And you know, I want to say too about hip replacements. A lot of people I know, my mom had hip replacement. She wishes she'd done it years earlier. And I think that's a word to people who are struggling with hip, you know, they're limping around for years sometimes. And they're so often grateful that they finally had it done because they get back to their life.
Correct. You do have to try. You do have to do a trial of conservative treatment, nonsteroidal anti-inflammatories, activity modifications, physical therapy, injections. Once that fails and it affects your activities of daily living, you go to a surgeon and they fix you. Yeah. So in the end, it doesn't really matter what approach a surgeon utilizes as long as they're proficient in it. You'll end up with the same result.
That makes
but
sense.
again, me using the anterior approach, the recovery is faster because you're not taking any muscle down. Your pain is less because you're not taking any muscle down.
Is there less blood loss too? Because I know a lot of people have hip replacements struggle with that post-surgery.
With anterior approach, it has been shown that you do have quite a bit more blood loss than the front.
Wow.
And that's, you need to find one of the arteries that's deep inside and avoid it.
Gotcha.
Occasionally you don't, occasionally it's in the wrong spot and you end up hitting it.
I see.
Good stuff, guys. Thank you.
Yeah. Okay. So you guys do same-day appointments as well. So you can call for that for a same-day appointment right now at Advanced Foot and Ankle of Wisconsin. It's 414-281-1500, advancedfootanklewi.com, and you also speak Spanish there as well. Hablamos español.
Oh, nice.
You like that?
Dude, I'm impressed.
Thank you.
That was good stuff, right?
Yeah,
It is.
Thanks, you guys.
Nice job. you
Great
guys.
to see you.
Thank you.